no country wants to find the new disease X, right? It's all about strengthening systems that allow us to work on existing problems. And one of the biggest challenges that most countries are facing right now is the issue of antimicrobial resistance. So we're fortunate to have Jeremy Farrar joining us from the Wellcome Trust. He's the director of the Wellcome Trust and chairman of the Human Health and Potential International Advisory Committee here in Singapore, which looks at innovations that really maximize both human and economic impacts. So Jeremy is going to give us about a 20-minute or so overview on issues of antimicrobial resistance. So warmly welcoming him. Thank you.
Good morning, good afternoon, good evening. It's afternoon here, but I'm not sure what time it is for anybody, either live or virtually at this meeting. It's a great pleasure to be able to join the 7th World One Health conference. I'm bitterly disappointed not to be able to be there in person, just unavoidable, I'm afraid, but I'm certainly within spirit, and I'm delighted to say that Wellcome has contributed to the conference, which I hope has facilitated people who wouldn't otherwise have been able to get there. And whilst still we're all learning how to deal with virtual conferences and hybrid meetings and the rest of it, it is also an opportunity that those of us who couldn't make it can nevertheless, I hope, make at least a small contribution to the conference. So great pleasure to join. And I know there's a lot of old friends and young friends who will be there, so I hope you enjoy the rest of the conference. Apologies that I don't notice it, but I've got something of a hangover from a non-COVID bug that I acquired about 2.5 weeks ago, but my voice is not back to what it was yet. But I promise you, at least virtually, I'm non-infectious, and it wasn't COVID. So I was asked to give some comments more broadly, I think, across the whole infectious disease space and the One Health agenda, but specifically about antimicrobial resistance, and I'm delighted to do so. It's both, I think, something of a pessimistic, but also I hope I'm going to finish with opportunity and optimism where I finish with. But what I would start with is, I'm not sure that I've ever known another time in certainly my professional life when I think as a world we face so much challenge and uncertainty. Of course, there's the challenge of the ongoing COVID pandemic. There are the ongoing pandemics of malaria, of HIV, of tuberculosis. There's the growing threat of emerging infectious diseases, of dengue, of chikungunya, and many others. And of course, there's the long-standing but still problematic enteric infections, respiratory infections and elsewhere. Infectious diseases are not going away, whatever people perhaps 40, 50 years ago thought that we were on top of. And of course, in terms of antimicrobial resistance, which everybody at the conference will know about, but I think is worth restating, this isn't just about infectious diseases, because the antibiotics, antiviral drugs, antifungal drugs, antiparasitic drugs and others are actually the bedrock of the whole of modern medicine. It is impossible to do routine surgery, hip operations. It's impossible to care for people with cancer or people with diabetes or people who are in long-term care for whatever reasons, and many more, safe childbirth. It's impossible to have that routine and safely done, let alone in emergencies, if we cannot prevent and then treat infections that inevitably arise in those conditions. So many of us come from a background in infectious diseases, but we should never stop and think that this isn't actually the underpinning of the whole of modern medicine and indeed public health. And so that is where we are. I think we're also facing in that very uncertain world and precarious world at the moment, almost impossible to think that we would both be living through a pandemic, that we would have war in Europe and war in the east of Africa, that we would have inflation levels destroying economies at this rate, and political turmoil and indeed geopolitical tensions, which are making global approaches to anything at the moment extraordinarily difficult. And antimicrobial resistance is a sort of poster child of many of those issues, because it is a classic issue of market failure. We have not valued antibiotics in the human, the agriculture, the animal sector as one of the greatest inventions and discoveries of history. We haven't valued them. We have treated them in ways that we thought we would always have a pipeline of them, and of course that's not been true. And the science behind the development of new antibiotics and antivirals, and when I say antibiotics, I do want to make sure that we are including not just antibiotics, but antifungal, antiparasitic, and indeed antiviral drugs. It's the drug resistance across that whole pipeline which is so important. But because we haven't valued them, and because we have not been able to discover new ones, but also look after the ones that we've got, it's meant that we have not had the new pipeline and we've not looked after the existing ones that we've got in a correct way. So it is not just a question of science or research and development, it is a question of a complex systems approach which crosses human and animal health, which crosses regulation and stewardship and money and incentives and political will and regulators, but also the value we put on this as society. And in those complex ecosystems, it's often easy for things to fall between the cracks because we require everyone to work together if we're going to solve the problem. There isn't just a simple scientific solution to it. There isn't just a simple technological solution that we can come to. That without the engagement of communities, without the involvement and stewardship of the antibiotics we've got, without understanding of the science, the pharmacology, the PK and the pharmacodynamics, without the appreciation that antibiotics must be used in combination, not mostly as sole therapies, without crossing into the human, agricultural and animal sector in the One Health principle, then we're not going to be able to solve these problems. And unfortunately, there has been a degree of I think conservatism and, I hate to say it, but a degree of ignorance amongst clinical and public health authorities about the impact of antimicrobial resistance, but also there's been a lack of political will to address both the financing of it, but also the pull mechanisms of the incentives and the regulatory environments around it. And it's in those complex global situations where an antimicrobial resistant pathogen can arise in one country, anywhere in the world, but can spread very quickly to anywhere. And when you're in a world which is so fractured and which is geopolitically in such tense times, plus the economic and other issues that of the moment, it's extraordinarily difficult to try and fix these. But we have to fix them because what's at stake here, as I said at the start, is not just infections that are resistant, but it is actually the whole of modern medicine and the whole of public health. What is crucial, I think, is that we don't just describe the problem. As a scientist, and I still call myself a scientist, or as a public health person, we are sometimes guilty of describing the problem and thinking that more descriptions, and indeed we do need more evidence, but more evidence will persuade people of a need to change. I think we need to become more streetwise in how we're doing this and realize how we need to make the case for antimicrobial resistance that would both convince communities, society, public health practitioners, nurses, doctors, people in the agriculture and animal sector, but also critically the political class that we know are absolutely needed in terms of political will. And in today's world, it's very difficult for politicians, I think, in any type of government to both deal with the great challenges that they face, and they do face great challenges day to day, today, tomorrow, the next day, next week, which are acute and which are very troubling, but also have the long-term perspective of how do we address these challenges that are going to play out over the next year, the next 5 years, the next 10 years, and the next 20 years. But if we allow them to play out, would be absolutely disastrous in terms of our ability to have public health, have modern medicine, and indeed to have the societies that we wish to have at the moment. So antimicrobial resistance to me is not the acute crisis of COVID, but it is more akin to the chronic, long-term, sustained problem that we are brewing and building up, more akin to climate change than it is to the acute crisis. And we know that during the acute crisis of COVID, it was possible to leverage and to create structures and indeed finance to a level that is almost unthinkable in other areas. And I think it's that lesson of how do we ensure that the people we work with, the communities we work with, our medical and scientific colleagues in the human and agriculture and animal sectors appreciate the need to come together, to appreciate this is a complex ecosystem, but that is not the same as saying this is somebody else's problem. And I think that is the community that we need to try and create now and ensure that the message is owned by people at most risk. It's owned by people who can make the strongest arguments for this, including in the human and agriculture and animal sector. And then we can make sure that the political will is there to make sure that we make the changes that are required around stewardship, looking after the antibiotics that we've got, and making sure we have the push incentives through investment in science and the pull incentives to make sure that actually in the end, because we need the private sector, that the private sector can be involved and can make a profit from these things. And we shouldn't shy away from the idea that people need to make profits from the discoveries that they make. What is the opportunity? Because that's quite a bleak outlook that I've defined there, and sometimes it's impossible to lift your head and ask yourself, well, what are the opportunities? And I think we have to really focus on what those opportunities are. Science over the last 3 years has demonstrated what it can do when it's liberated and it's backed with sufficient financial resources. You can change the world through science, as we've learned with the development of both antiviral drugs for COVID, but also about non-pharmaceutical interventions and, of course, the coming of vaccines. So humanity has an amazing ability to adapt, to innovate, and to produce solutions when it's backed to do so financially, politically, and socially. And that is, I think, the coalition that we need to try and drive. The second is to say that what have we learned from COVID that could now play a role in antimicrobial resistance? And my very strong belief is, as we put in place systems that we hope will improve surveillance in the animal sector, the agricultural sector, and also the human sector, that we use antimicrobial resistance as the bedrock of that surveillance, so that the surveillance is not just there to pick up an epidemic or a pandemic that may or may not happen tomorrow, next year, 5 years from now. But I very strongly believe that surveillance will only be sustained in communities and supported financially if it is providing value and utility all of the time. And in order to do that, it has to be providing value to the people who are going to use that. Doctors, nurses, public health officials, so that they have the information they need that can change practice and the community can trust the information they have available. What I would be very strongly opposed to is now setting up another vertical system which focuses only on so-called epidemics and pandemics, when we need systems that are stronger, surveillance in place, we look after the drugs we have, and that we have the data flowing into people that can then use that data today, tomorrow, next week, next month, whether there's an epidemic or pandemic or not. And my view is perhaps the one thing that can tie all that together and ensure its sustainability is surveillance, and surveillance around antimicrobial resistance. It requires classic microbiology, it requires public health, clinicians, nurses, practitioners in rural communities, in intensive care, in tertiary hospitals, and it requires the political and financial support to do so. If we put surveillance for antimicrobial resistance at the core of our long-term commitment to surveillance to improve both therapies and treatment, including for infections and drug resistance, then I think we would also be much better prepared and be able to pivot to emerging infections and emerging issues when they occur. So I think that is the opportunity on surveillance, which will be rolled out in the pandemic, COVID era and beyond. And I think we can build antimicrobial resistance and pay tribute to many people who are doing around the world. I will just pick out Dame Sally Davis and what she did in leading the arguments for this antimicrobial resistance, and Prime Minister Moti from the Caribbean, who's led this call through the expert group that's been convened that I'm proud to be a member of. The second is, and this relates to Wellcome and my role at Wellcome, is to make sure that we are also making the science available. We do need to identify new targets. We need to understand the pharmacology of the drugs we've got. We need to understand how we use combinations much better. When I was a medical student, I was taught to use a single drug, an antibiotic, at the lowest dose possible for a long time. I think now most of us would argue you should never use a single drug on its own. You should use combinations. We should be much better at using bigger doses, and we should be much better at using loading doses, I believe, when that's appropriate. But that requires very strong pharmacological backup, and I think pharmacology is one of the great neglected sciences of our age, and I'm delighted that in Singapore there is such a strong commitment to the pharmacological sciences, and pick out also the Morrow unit supported by Wellcome that's done so much for antimicrobial resistance and pharmacology, and that is so crucial to understanding the future of how we look after the antibiotics we've got. And then the last thing I'll say is we talk about preserving antibiotics for those untreatable infections. That is very important. We must make sure that we look after those drugs. But we should also remind ourselves that in many parts of the world, in Asia, in Africa, in Central and South America, and indeed North America and Europe, actually access to antibiotics is not what it should be. Many people die globally or have chronic infections because they do not have access to the best drugs and in the best doses. And whilst we should preserve drugs well, we must make absolutely sure we're using good drugs well and that we're making sure they're accessible to all communities, including those marginalised and in low and middle income countries, because this is not about just preserving good drugs for people in rich countries. This is about making sure there are drugs available in the right way, looked after in the right way, preserved for the future generations, and it's available and accessible to everybody, independent of ability to pay. And if we don't combine access alongside stewardship, then I worry that we will not be addressing the issues of infections. Too many infections go untreated, and too many infections do not have access to the antibiotics they need. And then finally is the role of non-pharmacological interventions. And there I think infection control is neglected and underappreciated. I would argue that surveillance can help make the case for that. Infection control in clinics, in communities, in hospitals, is not where it needs to be, and that leads to problems of antimicrobial resistance, but it also leads to problems, of course, of amplification of epidemics. And so it has a dual role if we could get infection control better. And the other is, of course, WASH, sanitation, and looking after sanitation in all countries. And then the last element, which of course is a pharmacological intervention, is I think we underestimate the critical role that vaccines play in preventing infections and therefore reducing the need for overuse of antibiotics. So that's a whiz through. There's nothing I've said there which I guess anybody in this audience wouldn't know of before I've said. I have no access to information that you don't. I think we need to reach out beyond people attending these conferences. We need to reach out beyond people that get it already around the importance of antimicrobial resistance, and we need to speak more broadly to society, to communities, so that they lead the political arguments as well as clinicians and scientists like us, and we need to speak in a more streetwise way to our political colleagues and friends to make sure that they get and they understand the critical role that infection control and the ability to manage and treat and prevent infections are to the whole of modern medicine, from routine hip operations to cancer care to diabetic care and to safe childbirth. So thank you very much for asking me to join. I hope I didn't speak for too long. I'm really sorry I couldn't join. I hope I get an invite back next year, and look forward to seeing everybody in person at some point.